Yes, students. Today we'll discuss our second lecture on topic that is adulteration and evaluation of food drugs. Uh, Today we are going to start with quantitative microscopy as a method for evaluation of crude drug. Now, quantitative microscopy here uh, there are different parameters which we consider in the quantitative microscopy. These parameters are like length and width of the fiber. Then is diameter of the starch grains. Then there are various leaf constants. Like in leaf constants, there are stomatal number, stomatal index, vein islet number, palisade ratio. Okay, they come under it. So first of all, we will study about the palisade ratio. Now, what is palisade ratio? It is basically average number of palisade cells which is present beneath the epidermal cell. In a dropa, they are around 6 to 10. In digitalis lanata, they are 2.5 to 6.5. Then comes stomatal number. Now we have already studied about stomata. Stomata is basically which is present on the epidermis, which is meant for exchange of gases. It is having a central core which is guarded by guard cells followed by various types of subsidiary cells. In stomatal number, what we do is we determine average number of stomata per square millimeter area of the epidermis. Okay. In Atropa belladonna, it's around 6 to 14, which is present on the upper surface, whereas on the lower surface it is 62 to 93 to 174. Then comes stomatal index. It is a percentage which the number of stomata forms to total number of epidermal cells. Now it is calculated by this formula stomatal index SI. It is equal to S multiplied with 100 divided by S plus E. Now what is S? S is number of stomata per unit area. What is E? E is the number of epidermal cells in the same unit area. Okay. So Atropa belladonna, its value may range, stomatal index range for 2.3 to 10.5 on the upper surface, and in lower surface may range from 220 to 23. So any value less than or more than this, it may be some adulterant is added. Then come vein islet number. Vein islets, basically their small area of the green tissue outlined by veinlets, that is called as vein islet. Now vein islet number is average number of vein islet per square millimeter of the leaf surface, midway between midrib and the margin. Okay. In case of digitalis lanata is 2 to 8, digitalis purpura it is 2 to 5.5. Then comes vein termination number. Vein termination, they are basically ultimate free terminations of the vein islets or branch of the veinlets. Now vein islet termination number is basically average number of vein termination per square millimeter of the leaf surface, midway between midrib and margin. For Atropa belladonna, it is 6.3 to 10.3. Then comes various other methods that is called physical evaluation. Here we take physical constants to determine the physical constants of the crude drug to evaluate it. Now, what are these physical constant or physical parameters? They are moisture content, specific gravity, optical rotation, refractive index, melting point, viscosity, solubility in different solids. Then these physical properties, along with this, there are other values also which are determined. That is ash value. Here we determine total ash, water soluble ash, acid insoluble ash, and sulfated ash. Then foreign matter is also determined. Fluorescence analysis is also done. So these are the physical values. First is the moisture content. Firstly, we try to determine how much moisture content is present in a particular drug. Okay, for this, there is a appropriate value. It should not be more than that value. Moisture. Now, how we determine is determined by heating the drug at 105 degrees centigrade in the oven. So 105 water will evaporate such that to obtain a constant weight. After determining constant weight, we try to determine the percentage drug content. For drugs we having volatile matter, we carry out toluene distillation. Like for aloes, moisture content should not be more than 10%. In case of acacia, it should not be more than 15%. If it is more than 15%, that it means some other thing might be present. Then viscosity, we also determine viscosity of especially liquid drugs in order to standardize it. Like we can use various methods, various instruments can be used, which are called viscometers, like liquid paraffin, the viscosity, kinematic viscosity, that is viscosity per unit density. It should not be more than 64 centistole at 37.8 degrees centigrade. Then melting point, we try to melt the substance in order to determine its melting point. Melting point also tell about the purity of substance. If the, for example, cocoa butter should melt around 30 to 33 degrees. If it is more than this or very less than that, it means some problem in the cocoa butter. It might be adulterated. Then beeswax, it should have melting point of 62 to 65. Wool fats, it should have melting point of 34 to 44. Then we try to determine the solubility of the drug, especially these oils, castor oil. We try to determine the solubility in alcohol and various other solvents. Already, various drugs, their solubility is given in the various monographs. If you see in which is present in the monograph, basically description of the drug and other things which are given in the pharmacopoeia. If it is deviating from that thing, solubility is not appropriate in that solvent in which earlier in monograph it is written it is soluble, there will be some problem. Might be some adulterated material is added. Then optical rotation, this property is basically rotation of the plane polarized light uh, of a given solution. When plane polarized light is fall on the solution, it either reflected right or left. Okay, certain oils like castor oil, clove oil, they have an appropriate value. If it is deviating from this optical rotation value, then it is some problem. Similarly, effective index. Effective index is the ratio of velocity of light in vacuum to the velocity of substance. Velocity in the substance. We try to pass the light, okay, to the medium. Now, when the light passes, it deviates. How much deviation has been done from the original path? It can be done by running the refractive index. Uh, Different oils generally have different value of refractive index. If the value is different from what's given in the monograph, then it might be adulterated. Then yes, we also determine the ash values. Ash value is basically when we it's basically the residue which is left after incineration. Incineration means burning of the material, the ash which is left after the burning. That is called ash content. Now, see if the drug is mixed with certain chemicals, other chemicals. the ash content of the pure drug would be different. If the pure drug is mixed with the certain other chemicals, ash content would be different. Ash content of pure drug is different. Ash content of drug adulterated with the substances, either partially or fully, it would be different. So we determine the ash content. Try to determine various types of ash content. Like we determine physiological ash with non-physiological ash. Physiological ash is basically the pure drug. If it is burned, the ash found will be physiological ash. If it is mixed with certain types of minerals like sand, soil, calcium, and the ash which we found will be non-physiological. So what we do is for determine total ash, we incinerate 2 to 3 gram of accurately weighed substance over platinum or silica dish at temperature not exceeding 450 degrees centigrade until no carbon dioxide is there, gas evolves. Then it is cooled and weighed. So then percentage of ash with the reference of air dried drug is carried out. Weight of total ash divided by weight of crude drug multiply with 100 will give us the total ash value. For a lows, it should not be more than 5%. For a shokta, it should not be more than 11%. If it is deviating, then there is some issue. Then we try to determine some other types of ash, like acid insoluble ash, ash which is insoluble in the acid. Generally, uh, the ash which is obtained after the first method, we boil it with again with 25 ml of 2 normal HCl for 5 minutes. The insoluble ash was then can be collected with the help of filter and washed with hot water. Then it could be weighed to determine how much acid insoluble ash is there. Ash will be soluble, that will go. Which is not soluble, we will try to take it out. And then by filtering, and then we will wash it with again with hot water, dry it to determine its weight. These are the value of acid ash value, acid ash insoluble, sorry, acid insoluble ash, which is given in percentage weight by weight. For agar, it should not be more than 1%. For amla, it should not be more than 2%. Then water soluble ash can also be determined. Same way, you can use different solvents. Here you can use chloroform water with around 25 ml, which is in which the ash which was obtained earlier could be added. Uh, the acid insoluble ash could be separated by filter. How much then it would be weighed. Then this acid insoluble ash would be minus the amount of acid insoluble ash is minus from the total drug. It will give us the value of water soluble ash. Okay. Then we're using this formula that the water soluble ash divided by weight of the crude drug into 100, we can determine the water soluble. Then sulfated ash. Here we can use silica crucible, which is heated to redness for 10 minutes, then which is allowed to cool in desiccator and weighed. The total of ash obtained can be taken in this crucible, weighed accurately. Then it is ignited gently first until substance thoroughly charged. The residue could be cooled, moistened with 1 ml of sulfuric acid, heated gently until white fumes are no longer involved, and then ignited at 4450 degrees centigrade until black particles have disappeared. Then the crucible could be allowed to cool. A few drops of concentrated sulfuric acid is added and heated, ignited as before, allowed to cool. The percentage of sulfated ash will be weight of the ash left divided by weight of the crude drug taken multiplied with 100. Then we can also determine the foreign matter. Just what we have to do, we have to take 100 to 500 gram of drug sample, uh, which is spread on a thin layer. Then foreign matter can be detected by unaided eye or by using a lens. Okay, they can be separated and they can be weighed to determine its percentage. Then certain chemical evaluation tests are also there. Here we use various drug is having certain chemical constituents to which it shows certain biological or pharmacological activity. We can use qualitative chemical tests to identify certain drug or its purity. What we can do is chemical evaluation. We can extract crude drug using solvent extraction. Then we can carry out preliminary phytochemical screening. In preliminary phytochemical screening, we can carry out these tests. What we have done: acid wash, sulfated ash test, vectorable. Okay. Then we can go with chromatography and spectroscopy. Now, preliminary phytogramming screening can be done for various types of drugs like alkaloid, glycoside, flavonoid. The number of tests available, like Mayer's test, is done for alkaloid, which will by adding Mayer reagent, creamy white peptide will be formed. Then Wagner tests can be done. Here Wagner reagent is used. Reddish brown peptide form. It means it is alkaloid. Hager's test basically is saturated solution of picric acid, which is added. It will give yellow precipitate. Then drag and drop test is there, in which reddish brown precipitate, if it is forming with the drug by adding drag and drop agent, means it is alkaloid. Then for steroids, Sulmoxy test, Lieberman Butcher test is also there. This can be done. Then triterpenoid, Sulmoxy test, Lieberman Butcher test. This can be performed. For tannins, gold beater skin test is there. Gold beater skin is basically a membrane which is prepared from the intestine of ox. It look like it behaves similarly as that of untamed hide. Okay. If by adding certain reagent over this untied hide, if brown black peptides are forming, it means there is presence of tannins. Then phenazone test is also there for tannins. Gelatin test is also there. So these are the tests which we carry out. Then for volatile oils, we can determine the volatile oil by various reagents like Sudan 1, Sudan 3 can be added. Then flavonoids, we can carry out the test of alkaline reagent tests, magnesium turning test, zinc test, perchloride test. For phenolic compounds, separate test is there where we try to extract the material, then we add ferric chloride solution into it. If dark green color peptide is forming, it means it contains phenolic compound. Then test for gums and mucilages are also there. We take firstly make a extract, then we try to add 25% of absolute alcohol. If the precipitation occurs, it means it is gum and mucilage. Then glycosides. These are basically compounds which on hydrolysis give one or more sugar, and the sugar moiety is called glycone, and the non-sugar moiety is called aglycone. So it's basically a combination of sugar with the glycone moiety with the aglycone moiety. Various tests can be carried out for glycoside like Bontrager test, Killer-Kilani test, Lieberman-Butcher test is also there. For amino acids, the tests like Ninihydrin test, Xanthoprotic test, they are also there, and Millen's test. Millions, we take 1 ml of sample, we heat it for 3 minutes, then we add sodium nitrate into it. Red color is formed, it means the test is positive. The substance is containing amino acids. Then test for saponin is there, like foam test, hemolysis test. This can be done. Last but not the least is test for carbohydrates. We use Molly's test in order to detect whether carbohydrate is present or not. So these were the chemical tests. Last, I will try to tell you about one more technique which is called as biological methods or bioassays. Certain tests are there in order to determine the potency of the crude drug. When we try to determine the potency of the crude drug on, say, animal or say microorganisms, that is living organism, it may be bacteria, it may be fungus, it may be animal, or it can be a part of the animal like tissue of the animal. Then it is called as bioassay or biological evaluation. Generally, biological evaluation is done to determine the therapeutic activity of the crude drug. It is generally given with units like international unit, IU. Now, as I have told you, this can be done on live animal, bacteria, fungus, or it may be done on the tissue. So different methods are there, like tissue method, toxic method, symptomatic method. These drugs like cardiglycosides, natural pesticides, antibiotics, they are their activity is determined on these by this method, that is bioassay method. So this is all for today. We complete this topic regarding adulteration and evaluation of crude drugs in pharmacopoeia. Thank you.